by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It is also sponsored by Comfort Care and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Paul Cespedes. I'm co-hosting today with Dr. Kashif Chaudhry. We have a lot of great shows coming up. Be sure to check out the website, DocTalkLive.com. And also, we're on YouTube and Facebook, so check us out there as well. I want to make a quick announcement. Dallas Renal Group is partnering with the Texas Kidney Foundation to host a free screening event on Saturday, November 11th at the Central YMCA in Arlington. The event is free and open to the public from 9 a.m. until 4 p.m. It only takes about 30 minutes to get screened for kidney disease and talk one-on-one with a medical professional about your results. Be sure to bring your friends and loved ones. Again, the free screening event is on November 11th at the Central YMCA at 2200 South Davis Drive in Arlington, Texas.
This is Dr. Chaudhry, your co-host for DocTalk Live. Today, my fellow listeners, we have a great show for you all. This particular topic plays a major role in increasing one's survival rate that may be battling this health issue or know someone who is. Organ transplantations have gradually increased in the last 2 decades and have provided excellent results and improvement in one's quality of life. That's why today we will be discussing kidney transplants. And we have Dr. Irfan Agha and Dr. Christie Gooden in the studio with us. To be part of the conversation, please call us at 972-235-5555. Once again, that number is 972-235-5555. We'll be happy to take your live calls throughout the show. Dr. Gooden, Dr. Agha, welcome to DocTalk Live. Thank you very much for volunteering your time to be part of this show. Please tell our listeners a little bit about yourself. Dr. Gooden.
Well, good evening, DFW. My name is Christie Gooden. I am a recent movie to the Dallas area. I have joined the Medical City Dallas team where I work with Dr. Matt Malloy and Dr. Agha here, and I am an abdominal transplant surgeon. I perform kidney, pancreas, liver transplants as well as dialysis access, which I have a special interest in as well. And Dr. Agha.
Good evening, DFW. My name is Irfan Agha. I'm a transplant nephrologist, and I practice out of Methodist Dallas Medical Center as well as Medical City Dallas, where I also serve as the director of the live donor kidney program and kidney parent donation. It is my very great pleasure to be here with Dr. Gooden and you all this evening to answer your questions about kidney transplantation.
All right, great. Thanks again for coming on the show. I really appreciate it. Dr. Agha, we're going to start with you for our first question. The National Kidney Foundation reports there's over 120,000 people waiting for life-saving organ transplants in the U.S., and over 3,000 new patients are added to the kidney waiting list each month. For that matter, can you explain to us what exactly is a kidney transplant and why is it necessary?
There are many different diseases, like very common diseases like diabetes and hypertension that can lead to damage to the kidneys. And once this damage exceeds a certain point, the kidney function is unable to sustain life. In such circumstances, we have to replace that kidney function either through dialysis or through placing a new kidney. This process of taking a kidney from a living or a deceased donor and placing it in someone with kidney disease is called kidney transplantation. For many patients, this is a life-saving procedure. For many others, this is a life-enhancing and prolonging procedure.
Dr. Gooden, who qualifies for a transplant? Is there an order for qualification?
I think that's a great question. There are a lot of people who rule themselves out before they even get evaluated. So any patient who has CKD 4 or 5 onto end-stage renal disease can potentially be a transplant candidate. They have to go through an evaluation. Now, that evaluation includes seeing a surgeon, a kidney doctor, a social worker, financial. There's a whole team, it's a multidisciplinary team to examine the patient and evaluate them from top to bottom to say, okay, can you benefit from transplant? Can I not only improve your quality of life, but your quantity of life? So in terms of an order of qualifications, I don't think there's a specific order, but I think that a patient would necessarily, yes, have to have demonstrated disease that's not going to improve, that we do not feel is going to improve, and somebody that we think would not only benefit from transplant, but would take care of the transplant. That's a specific thing that's important to transplantation. You can't just get a kidney and ride off into the sunset. So there's a whole team behind us that are there to help with these patients.
All right, let's take a live call. Hi, welcome to DocTalk. Go ahead with your question, please. All right, good question. Dr. Agha.
Well, many people, like you just outlined, are born with one kidney and they lead healthy lives. One kidney is enough to sustain a healthy and a normal lifespan. This is why sometimes we take a kidney from healthy people and donate it to people who require kidney transplants. So no, if the person is otherwise healthy, they do not need a kidney transplant, but I would encourage them to discuss this with their physician and make sure that all the parameters that we use to define kidney health are checked out.
All right, folks, you are listening to DocTalk Live. We're live in the studio with Dr. Christie Gooden and Dr. Irfan Agha discussing kidney transplant. If you want to ask your question to our experts, please give us a call at 972-235-5555 to be part of the conversation. All right, Dr. Agha, so what exactly does that mean to be on a kidney transplant waiting list? How do you qualify to be on that list?
So, as you highlighted, kidney disease in this country is taking epidemic proportions. There's way more people with kidney disease than there are organs available to be transplanted. So what we have to do is to, after adjudicating someone to be an appropriate candidate, like Dr. Gooden had mentioned, to work them up to make sure that there's no medical or other contraindications to the process. Once we adjudicate that they are appropriate candidates for transplantation, we have to place them on a list where they await their turn for an appropriate organ to become available. This problem would go away if there were enough organs available to be transplanted, but at this point there's more than 100,000 people waiting on the list already. So this is a serious problem, and this is a problem we are all trying to solve here.
Dr. Gooden, who makes the decision about who will receive a kidney once the organ is available? And when is the best time to get a transplant?
Okay, so in terms of deciding when a person gets a kidney, when it becomes available, there's a whole process behind it. As Dr. Agha said, the patients get on a waiting list. Now, the waiting list is based on how long you've either been on the waiting list or how long you've been on dialysis, depending on when you've been placed on the waiting list. So, for instance, the wait time in our region is 5 to 6 years. So when I get a phone call about a donor that's in our region, the patients that are normally getting, are normally on the list or top of the list are people who've been waiting the longest. And then as the surgeon at our program, the surgeon is the one that goes through the donor's entire history and decides, is this organ an appropriate organ for my donor that's number one on the list? And if I feel like it's not an appropriate donor for my patient, I will turn it down, and then so on and so forth. So in terms of who's at the top of the list, it's the people who have usually the longest time. There's some other parameters, but that's usually who's number one. The best time to get a transplant, the data has shown that actually the best time to get a transplant is before you're ever actually on dialysis. It's called a preemptive transplant. Usually those patients get a living donor prior to being on dialysis, so these patients tend to be live longer, the kidney tends to last longer, and so that's really the best time. But if you are a person who gets placed on the list before dialysis and you do not have a deceased donor, or excuse me, a living donor, then you have to wait the 5 to 6 years for a deceased donor, and usually by that time you're going to end up being on dialysis.
All right. So we've kind of talked a little bit about wait time of 5 to 6 years and then living donors. So can you maybe explain the two different types of transplants, Dr. Agha, and what exactly is the difference between a living or deceased donor?
So, as the name implies, a living donor is a healthy, non-obese volunteer who wants to donate a kidney to a loved one, to a friend, to a complete stranger. We've had all types of live donors. The deceased donor, on the other hand, is someone who has succumbed to some form of illness, and they, through their own volition or through the kindness of their family members, have agreed to have their organs donated. So the difference is in the way the organs are handled. In a live donor situation, it is a very controlled operation. In a deceased donor situation, there is some transport because there's a national registry and a regional registry, so there's some transport, etc. involved. The results that we see are better with live donor kidney transplant compared to deceased donor. But I want to preface this by saying that the results of any type of transplantation are much, much better than staying on dialysis. So I want to highlight that point, and we'll talk about that a little bit later, I hope, that it is imperative for anyone who's on dialysis and can get a transplant, they should try to do that.
Dr. Gooden, what happens during the transplant surgery? What medication will one have to take after surgery? And the most important question, who pays for the cost of transplant and other medications?
Sure. So in terms of what happens during transplant surgery, I think it's important for people to understand we do not take out their old kidneys. We don't even look at them. There's a lot of what I call high-priced real estate around the organs, and we're trying to make this operation that's as easy as possible and one that's easier to recover from. So most patients, what we do is we make an incision just above the hip bone to get down to the blood vessels of the leg. We then sew the blood vessels of the kidney to the blood vessels of the leg so they share blood supply. We then take the ureter, which is what carries urine from the kidney to the bladder. The bladder's right in the middle, so we just swing it on over, and when we're done, brand new unit right up front. Some people even name it. I've heard Ethel, California Kid. I hear it's good luck. So I always tell my patients that. So that's the transplant surgery in a nutshell. Afterwards, the medications that people have to take are known as immunosuppressive medications. It's basically a cocktail that sort of prevents the body from attacking the kidney. I consider it an electrical fence, sort of, that needs to be fed every day, that's lifelong, in order to prevent the body from attacking that organ. And in terms of paying for the cost of transplant, other medications, if you are an end-stage renal disease patient, you end up on Medicare and will be able to get your cost of transplant paid for.
All right, folks, we're about to head into a break here. We are live in the studio talking to Dr. Christie Gooden and Dr. Irfan Agha. We are discussing kidney transplant. Please give us a call at 972-235-5555 to ask your questions to our experts. We'll be taking calls off the air. Again, 972-235-5555.